The Reverend Dr. Martin Luther King once said, "Of all the forms of inequalities, injustice in healthcare is the most shocking and inhumane." With that in mind, more than 10 years ago, the Conference of Churches in Hartford, Connecticut, began its work to create health equity in our region, our state, and our nation. We realized that our commitment to social justice and the poor had to be looked at through different lenses, using ecumenical unity in new and powerful ways. Through our strength in faith-based community organizing and our modern methodology using traditional and social media, we've been able to engage over 5,000 faith leaders in the state of Connecticut to pass the Sustanet Bill for universal health care in our state prior to the passage of health care reform at the federal level. We committed ourselves to the work of health care reform because we could not stand idly by saying, "Peace, peace," and there is no peace. For on a daily basis, we saw people having different healthcare experiences and outcomes based on their zip code, ethnicity, and insurance coverage. And we knew that was not God's plan for humanity. Through our work in health equity, we created a culturally competent health ministry program which established over 30 mini health clinics and congregations reaching over 30,000 people in the region. The health ministry programs have taught people of faith how to be actors in their own health care and advocates for the health of the community. Healthcare advocacy created a new foundation for our more than 112-year-old ecumenical organization. We began to see that the expertise and gifts of the church could be a gift to the community in far-reaching ways. To measure this, we were commissioned by the city of Hartford to do a study to calculate the value of services to youth in our city across various denominational lines through congregations. Through our research tools, we were able to quantify the value of faith-based services for youth in our 18-square-mile city that was at $37 million worth of services through the churches. That was provided by people of faith in the areas of leadership and drama and art and literacy and health, music and education. This was funded by the church, and if it had to be funded by traditional philanthropic areas, it would have cost the city over $37 million. By quantifying the economic value of faith-based services, we took the ethereal nature of ministry and translated it to a language that funders and government leaders could understand. The new mission of the Conference of Churches is to engage transformational leaders to create a healthy and just community. Because of our work in health equity and justice, we have been at a place where we're providing faith-based service training, research, and consultation, and we recently were presented with bond dollars from the state of Connecticut to acquire a 30,000 square foot art center to serve as our headquarters and a leadership development and wellness center to uplift our community and care for those who serve our community the most. The Conference of Churches in Hartford, Connecticut is now seen as a key leader in transformational leadership, showing the power of Christ's love and life through unity.